Hi there everyone, Chris Gibson here, and what we're looking at today is finding the alpha male from within, and this is our fifth step in a video set that I've done on looking at this subject basically. And the last thing we're going to look at in the 5 steps is hormone replacement therapy. Now, this possibly is the most controversial subject of all, that some of you listeners might find a little bit difficult to get your head around. Maybe in America it's a little bit more common, but I think certainly in England it might be a little bit of a taboo subject. So what is hormone replacement therapy? Okay, so basically let's go into the fact of what we're trying to look when we say finding the alpha male. Again, finding our alpha male traits. You know, part of being an alpha male is feeling good about ourselves, feeling confident. To feel confident, you know, we like to feel like men. Part of feeling like a man is certainly to have high energy levels and certainly a reasonable level sex drive, and certainly not feel depressed and down. Now, one of the things that can be a cause for being depressed and being down, and certainly to have an issue with sex drive, or certainly maybe even erectile dysfunction, is having a low testosterone level. So basically how it works is from 30 years old, every year after our 30th birthday, our natural testosterone starts to drop every year. Now, is this a massive problem? Not necessarily. You know, there are things that we can do to keep our natural testosterone as high as possible, like a good diet, supplementation, vitamin supplementation, you know, drink lots of water, train hard. However, you know, is it possible that our testosterone level drops a little bit too low? Well, yes, you know, it's very possible. And typically, if you go to the doctors in the UK with a lot of the symptoms of low testosterone, like depression, erectile dysfunction, agitation, you know, mood swings, feeling cold, things along those lines, a lot of the time you will get given either Viagra or antidepressants, and the doctor won't tend to suggest that you go for a test to find out if your testosterone is too low. Even if you did have that test, the National Health Guidelines for low testosterone are so wide that even if you are right towards the lower end of the scale, it might even come back that your testosterone levels are not too bad, when actually you're feeling quite low and having a lot of the negative side effects from low testosterone. So one of the things we can do is hormone replacement therapy. So like I said, that testosterone drops every year. So what we can do is, by adding a certain milligrammage of testosterone to your body, maybe twice a month, we can recreate that feeling of being quite a lot younger, which basically makes a massive difference to our lifestyle. You know, having a higher level of testosterone. So, you know, very much the opposite to some of the negatives that I've mentioned. Our sex drive will raise, our mood swings will certainly raise, we will need a lot less sleep to probably do the same things. We'll generally feel a lot better and have a lot more energy, and our physical performance and mental performance will generally be better in all aspects. Even things like hair growth, nail growth, skin quality, all those things can improve. And hormone replacement therapy is administered by basically giving either a shot of testosterone. Either it can be as often as weekly, or sometimes every couple of months, as little as that, just to give you some hormone replacement therapy. It can also be done with creams and tablets. In my opinion, the best way of doing it is actually injectable. even though that is a little bit more intrusive, it's best transport system for the testosterone. And yeah, at the end of the day, it tends to the body has a better absorption if it's actually injected. And funnily enough, it can actually be safer because it goes directly in rather than being absorbed through the gut walls or the skin, etc. So it can actually be healthier in some levels. What are the downsides to this? I hear you ask. Well, actually, nothing, providing it's done safely. Okay. Potential downsides can be that, for example, if you had liver problems, kidney problems, or prostate problems, then it might be something that wouldn't be recommended. The simple reason is testosterone itself can enlarge in the prostate. So if gents, you have a particularly large prostate anyway, obviously that's going to be linked to prostate cancer. You don't want to take any supplement that's going to potentially enlarge the prostate anymore, so that's a no-no. So the recommendation is that if you're potentially looking at hormone replacement therapy, there's quite a few options. You could, one, ask your doctor. You could, two, ask myself, and I'll give you some details at the end of this video. Or you could, three, look, just literally Google the subject up. There are lots of private clinics and sort of private doctors and companies on the internet who are offering hormone replacement therapy now. And typically what they will do is they will get your what's called your blood work done. So they will basically test your liver function, your kidney function, your testosterone, and obviously your prostate, to check how low your actual natural levels are. And if they are worryingly low, they will administer the correct amount of testosterone to get you to feel an awful lot better, so that you can perform a lot better and have a better lifestyle. So when we're looking at a subject like I'm discussing, I bring back the alpha male, or find the alpha male from within. Obviously, to do that, you want everything right to enable you to do that. If your testosterone levels are low, it's very difficult trying to find something if you don't feel good. You can force things to a point, but actually, if we get that's why we've broken down in these 5 videos all the things to do things right, to put you in the right place to actually find what you're looking for. Because we'll try and push things and try and, even if you don't feel good, try and bring it out of yourself and find what you're looking for. But actually, if you haven't got the right foundations to get what you want, it's very hard to get it. You can push it for a while and try and fake trying to feel better and trying to tell yourself that you're all right. But actually, if you're not, you're not. You can't fake yourself to having a higher sex drive. You can't, if you're not interested in sex because your testosterone levels are low, and you've got erectile dysfunction, then it's quite obvious, isn't it, gents? It's not something it's something that's going to come across. So yeah, hormone replacement therapy is can be a massive positive to any men out there who might want to increase their performance, I would say, with life in general. One downside I should mention, already mentioned about the prostate, and obviously if you've got liver or kidney problems, and you don't want to put any additional substances into your body that puts more pressure on those internal organs. The other thing I should mention is the downside is basically if your body is low on testosterone anyway, and you start adding artificial testosterone, the chances are that what can happen is the body can actually stop producing testosterone altogether, because it's being introduced to your body artificially. Basically, the testicles basically say, I'm getting unnatural testosterone introduced into my body, so I don't need to produce anything anymore, and they shut off completely. The downside to that is if you're actually looking to have children, you might not be able to get your wife or girlfriend pregnant. So my advice would be, if you are in your 40s or 50s or 60s and you are looking to have more kids, then I wouldn't recommend hormone replacement therapy. If you still want to have kids and you want to try hormone replacement therapy, there are things that you can take. There are certain supplementations that we can use, namely HCG, Clovid and Nolvadex, that you can add to your body to help reboot your natural levels after you've used unnatural testosterone to supplement to raise the levels. So the point I'm making is, people say, if I start with hormone replacement therapy, is it something that I might have to continually do? And the answer to that is potentially yes, it is. Me, on a personal level, I'm quite happy with the fact that in order to feel good and conduct my life and feel better throughout, I'm quite happy to live with the fact that to do that, I will continually for the rest of my life have to supplement my testosterone, because I'm that happy with the effects it actually gives me. But that is a choice that you can work out for yourself. I'm basically trying to raise your awareness to some of the things that are available for you, and at least give you the opportunity to have a think about it. And if it's something that you want to do, great. If it's not, then no problem. Okay, any questions on that, please send me an email at chrisjgibson78@gmail.com, or send me a WhatsApp message on 07831 423 424. Like I've said before, if you want any therapy, coaching, or any form of training, I'm happy to do that for you. I do give a paid service, but I'm absolutely happy to give any advice that I can give to help anyone out free of charge, that's going to help move anyone on, or just generally put someone in a better place. Thank you very much for your time. Take care.